I'm Gary Kavit. I'm the medical director here at Riverside Regional Medical Center for the Emergency Department. I'm also the service line chief for emergency services for Riverside Health System. We have very close communication with 911. When they arrive on the scene and a patient's having stroke symptoms, they call us ahead of time and let us know about the case that they have. And if the case of suspected stroke, we immediately mobilize our ER team, and we in fact meet the patient by our CAT scanner and do an initial evaluation right outside our CAT scan room, and then quickly get the patient into the CAT scanner so we can determine whether or not a patient's having a stroke. Then we can intervene and reverse that stroke as soon as possible. It's so important to call 911 when you think you're having a stroke, because there's a very small window of time when we can do our interventions. We only have about 4.5 hours to intervene on a stroke to give, life-saving reversal medication, which if given outside the window of 4.5 hours could be actually increasingly dangerous to the patient. So we follow the rules very strict. So we have to get all of our work done very quickly. We have to get the patient to the hospital quickly. We have to get the patient into the CAT scan quickly. We have to make our decision to intervene quickly. So all of these minutes add up. And so we need people to come to the hospital as soon as they can. I have absolutely had patients who have waited at home until outside our time limit, thinking, well, let me just wait a little bit longer and see if the symptoms go away. And that is the wrong decision to make. When a patient comes to the hospital with a possible stroke, we first evaluate the patient right outside the CAT scanner and take them into the CAT scanner very quickly. The decision will be made off of the findings in the CAT scanner as to whether or not the patient can benefit by a blood clot medication that can break up a blood clot that's blocking the blood flow to the brain. On some patients, that may be all they need. On other patients, they may need to go to what we call the cath lab, where a very specialized doctor will take them to the cath lab and do an intervention where they can actually take out the clot that is blocking the blood supply to the brain.